He was a genuine refugee fleeing civil war and torture, but he gave up after waiting more than 2 years for release into the community. We're talking about the Sri Lankan man who committed suicide in immigration detention in Sydney overnight. ASIO had not granted his security clearance and advocates say he'd given up hope. Mental health experts describe the death as terrible and predictable and are calling for an urgent psychiatric and psychological review of all detainees. Karen Barlow reports.
This 27-year-old Sri Lankan had spent more than 2 years in immigration detention, first on Christmas Island, then at Villawood in Sydney. Tamil supporters say he'd fled torture and due to his history was living in what's known as immigration residential housing.
A place next to the Villawood Detention Centre which accommodates families and people of a greater vulnerability.
Last year he protested on the roof after the suicide of Josefa Raluni.
He has been very depressed. He's been on medication and seeing other people suffering, the other people self-harming hasn't helped.
He died from apparent poisoning after midnight. He'd been recognised as a refugee 2 months ago and was awaiting security clearance from ASIO.
We tried to talk him out of it previously. We told him that there is hope, but we couldn't give him a date. We couldn't tell him when he would be allowed out.
Obviously, any death at any time is a tragedy, and our thoughts and condolences are with his family and friends today.
It's the 6th suicide in immigration detention in the past year. 4 of those deaths have been in Villawood. It's understood the 27-year-old had attempted suicide before. The Tamil man had tried to get a day's leave from detention to see friends at a Diwali festival, but was refused permission on security grounds.
The Immigration Department and sadly the government have let this man down to the extent that he joins this increasing group of people who are so desperate that they take their own lives.
The system is under strain. Louise Newman says people are harming themselves in detention every day.
What needs to happen as an urgent action is an independent psychiatric and psychological review of all those within the detention system who have these sorts of risk factors, with a view of letting them have appropriate treatment in the community.
The Minister says there are currently 462 refugees awaiting ASIO clearances.
It's well known that not too long ago there were 1,000 people in detention who are awaiting their security clearance. That has been more than halved.
But Chris Bowen says this case was not simple.
It is the situation that this was a long, involved, complex and protracted case. The individual concerned was considered for community placement, but this was not pursued following consultation with the relevant security agencies.
We need to see, urgently, a reform to the mandatory detention system. We need time limits.
The Greens want a 30-day time limit on security and health checks. They say people could then be moved into the community while their claim is processed.
ASIO has told us already on the public record, they've said it in their own reports, that they can do it within a matter of days.
ASIO says it completes around 80% of security assessments within 1 week, but times can vary. And it says the government sets detention policy.
It is not a requirement under the Australian Security Intelligence Organisation Act 1979 that irregular maritime arrivals remain in detention during the security assessment process.
A coronial inquiry into the death is expected. Karen Barlow, Lateline.